So let's talk about IVF. It's a huge journey, and right at the center of it all are the ovaries. In this explainer, we're going to break down some of the most common ovarian challenges that can pop up, from something called poor response to endometriosis and even cysts. Let's dive right in.
Are you worried about how your ovaries might respond to IVF? Well, of course you are. That's a totally normal, completely valid feeling. You're putting so much of yourself into this process, and the what-ifs can feel pretty overwhelming.
And I really want you to hear this. You are so not alone. These hurdles are not only common, but they're also things you fertility specialists see all the time. They have a whole playbook of strategies to help. So our goal here is to walk through together and hopefully give you some peace of mind.
Okay, so before we get into the challenges, let's kind of set the stage. What does a perfect start to an IVF cycle even look like? What are your doctors secretly hoping for when you begin?
It all kicks off with something called ovarian stimulation. See, in a normal month, your body's really just focused on maturing one single egg. But for IVF, we want to boost those odds. So your doctor uses special fertility medications. They're called gonadotropins, which are kind of like a cheerleading squad for your ovaries, encouraging them to get a whole team of eggs ready all at once.
So how do they know if the cheerleading is working? Well, they play detective. They're looking for a few key clues. Blood tests will show a nice steady rise in your estradiol hormone. And on the ultrasound, they're hoping to see about 10 to 15 follicles growing to that perfect size, somewhere between 16 and 22 millimeters. And at the same time, they're making sure your uterine lining is getting thick and cozy, ready for an embryo.
But you know what happens when the ovaries are, let's just say, a little more reserved and don't quite respond the way everyone hoped? This is what's known as a poor response. And while it can feel really discouraging, it's a challenge doctors know how to work with.
Poor ovarian response, or POR for short, just means the ovaries are being a little stubborn. They don't produce as many eggs as we'd expect, even with all those cheerleader meds. A lot of the time, this is linked to something called a lower ovarian reserve, which is just a fancy way of saying there are fewer eggs left to start with.
Now, it's super important to clear something up here. You might hear POR mentioned alongside something called empty follicle syndrome, but they are not the same thing. Poor response means you get fewer eggs. Empty follicle syndrome is way rarer, and it's when the follicles grow, but there are actually no eggs inside them. It's a really key difference.
So how can your doctor get a sneak peek into how your ovaries might behave? They've got this awesome trio of tests. There's an AMH blood test to estimate your overall egg count. Then there's the antral follicle count, or AFC, where they use an ultrasound to literally count the ready-to-go follicles for that month. And finally, some day 3 blood work gives them a snapshot of how your ovaries are functioning. Together, these pieces give them a pretty solid picture.
Okay, let's shift gears and talk about another really common hurdle on the IVF path, endometriosis. This is a condition that can have a pretty direct effect on the ovaries and how they act during a cycle.
One of the main ways endo can throw a wrench in the works is by creating these things called endometriomas. You might even hear them called chocolate cysts, which sounds kinda nice, but it's because they're filled with old blood. The problem is, this isn't just a harmless sack of fluid. It's active tissue that creates inflammation and can actually damage the healthy ovarian tissue and the precious eggs right next to it.
And that really gets to the heart of the problem. With endometriosis, it's not just about the physical cysts, it's the whole environment of chronic inflammation that it creates. That inflammation can mess with the delicate hormone signals flying back and forth between your brain and your ovaries, which can unfortunately get in the way of healthy egg development.
Now let's be real. Hearing the word cyst when you're going through fertility treatments can be pretty terrifying. But I really need you to know that not all cysts are created equal, not by a long shot. Let's break it down.
Think of it this way. On one side, you have functional cysts. These guys are totally normal, completely harmless parts of a regular cycle. They almost always just go away on their own, no big deal. But on the other side, you have endometriomas, which we just talked about. Those are caused by a medical condition and can definitely play a role in your fertility. So if your doctor spots one of those simple functional cysts during an ultrasound, take a deep breath. In the vast majority of cases, it's not going to interfere with your IVF cycle at all. Your team will just keep an eye on it to make sure everything's cool, but usually you can just proceed as planned.
All right, we've gone through some of the potential roadblocks. Poor response, endo, cysts. So now for the best part. How do we actually navigate around them and find a path forward?
This is maybe the most important thing to take away today. There is absolutely no one-size-fits-all when it comes to IVF. It's not a cookie-cutter recipe. Your plan is, and it absolutely should be, tailored specifically for you.
And this is a perfect example of what that tailoring looks like. Let's say you have a lower ovarian reserve. Your doctor might suggest a mini IVF protocol, where the goal isn't a huge number of eggs, but focusing on the quality of the eggs you get. For endometriosis, they might use what's called an agonist protocol to calm all that inflammation down before they even start the stimulation meds. It's all about creating a plan for your specific body.
And sometimes that personalized plan goes beyond just medications. If there's a really large endometrioma getting in the way, or some scar tissue, a minimally invasive surgery called a laparoscopy might be recommended to sort of clean house before you start IVF, giving your ovaries the best possible chance to respond well.
Phew, okay, we've covered a ton of ground here. So if you're going to remember just one thing from all of this, what should it be?
It's this. Having challenges with your ovaries during IVF is so common. It does not mean it's the end of the road. Not at all. It just means your journey needs a custom-made map. And with the right team and a plan that's built just for you, these hurdles can absolutely be navigated. And as we finish up, I just want to gently remind you that everything we've talked about here is for educational purposes only and is definitely not a substitute for medical advice from your own doctor. If you're looking for more information on the whole IVF process, you can find a ton of great resources over at ivfforme.com.